Hi guys. For everybody that has missed the nursing staffing meeting, this month for February, I just I was going to record it and then just remind everybody that staffing meetings aren't mandatory, so they should not be missed. And if you're not going to make them, you need to reach out and tell us you're not going to make them. Come in March 1st, and 2nd will be a mandatory meeting again, and what it comes down to is we need to all attend this one for the nurses, and that means LPNs and RNs because of a VA that was filed. But to continue on for our February meeting, we discussed cell phone use. Cell phone use is not allowed on the floor. If you see your coworker using their personal cell phone on the floor, you need to redirect them and hold them accountable. Then we also need to listen to our charge nurse and treat them with respect. It is not acceptable to just blow them off, not do what they ask you to do. If they ask you to remove somebody's hearing aids, please listen to them and go do it, because if you're sitting around, they obviously need help if they're asking. Denim pass needs to be done on PM shift, no ands, ifs, or buts about it. If Blue Horizon and Ruby Ridge has extra time, you need to go down to Golden Meadow and help them pass their TENA. Garbages and linens need to be taken out each shift. Also, I know Golden Meadow morning shift has started or wants to or has already started doing their rounds prior to listening to report, so it gives night shift time to pull their garbages and remove their linens, wash things out of the hopper. If you do not do rounds with them and you find something on your shift, you are accountable. This is your issue. It is no longer the previous shift. You need to do rounds to hold them accountable. It seems like we don't have any accountability going on, so we just, we all work very hard, and I understand this. We all need to work together. Next item was goggles. Goggles need to be worn on the floor. I hate goggles just as much as the next person. Resident care areas include hallways, dining rooms, and anywhere a resident would come into contact with you. Then goggles need to be worn along with a face mask. Arlie had came and talked about the hip precaution video. She just was wondering if you have any questions. You guys can always stop and ask Arlie. Arlie will be attending a few meetings for a couple of months, so then you guys can get acquainted with asking her questions when you see her. Some other things she went over for therapy wise is body alignment for residents. It doesn't matter if they're in hip precautions or if they've had a stroke. Pain is going to increase if they do not have a straight torso to their hips. She found one of the residents sitting on more on one hip, and that caused an increase in lower back pain, tailbone pain, and leg pain. She just wants to let you guys know also that she cannot come up with a therapy schedule due to the flexibility and coming and going, people taking longer. She will try to reach out to the nursing staff to let at least somebody know that they'll be coming sooner or later to help to do therapy. Those were the main things. She was just wanted me to remind everybody that if you see somebody that's having pain with movement, you need to notify your nurse. They may not have pain sitting still, but they will have pain with movement if we don't address it before they start moving. Caitlin, our new administrator, joined the meetings and met about 15 of you. She's really nice. If you have a minute to stop down into Mary's office, please do so. And just introduce yourself. Let's see. So we had changed the behavior charting to go on to the CNA test, and it's looking great. It looks like you guys are charting more, but just a reminder to let your nurse know that you are redirecting behaviors. that you are seeing for a resident. So we do thank you for your great charting on that part. And to go with goggle use, we do need to use our mask appropriately. So that means they have to be over our nose and mouth. They have to be able to stay up with while you're talking. So there is extenders yet, or you have to do the tuck and tie method to get it to seal better with your face. If you're going into an isolation room, such as the ones we've had over the past weeks, and you're medically cleared for your N95s, you do need to switch into an N95 and then change out of your N95 into a regular surgical mask after leaving that room. It's not appropriate to not wear your goggles and not change your mask when you're going into those rooms. College scholarships. We have quite a few people on the scholarship program for GRV. If you work 10 hours to keep the scholarship, that is going to need to increase to 16 to stay on it for summer, and then going forward. So reach out to Elisa to increase it to 16 hours for you guys a week. Otherwise, come summer semester, you won't be qualified for the scholarship. Healthcare Academy has been uploaded for January and February, and March. So just letting you guys know, those do need to be completed by the end of the month. So if they aren't completed by the end of the month, verbal or written warnings will be going out for that. That is all for everybody except for the nurses. The nurses, I went over narcotic counting. So if the narcotic is off for your count, you do need to notify me. And then when you're on the phone with me, I'll either designate a person or I'll come up and reconcile the medication myself. When you're doing this in the verification area, please write no and then DON notified. So I know that you guys are aware and you did notify me. We had an executive decision about keeping eardrops in the medication room and not keeping them in the cart. So if you're looking for eardrops, please check the nurses station first before ordering any, or the medication rooms on the nurses stations. Liquid Ativan will continue with the double checks, mainly for the TMAs. But if we see an inconsistency start again, it will restart for the nurses. Testing, with a staff member is sick, you do need to notify the infection control nurse, which will be changing to Kim. If she is in the building, if she's not in the building, then you need to notify me either at home or that I'm in here. With new resident admissions, we are to test them upon admission and then 5 to 7 days later. And I think I have it scheduled with Caitlin for day 7 to be tested, and that will be in the EMAR. With testing also, the guidance has changed for vaccinated staff, and it's now worded as up to date, which means if you are up to date, you're 2 weeks after your initial series and within 5 months of a booster, you're up to date. If you're qualified for the booster, which is about five months after your second dose, you do need to return to testing. So I did send out a message. I do have a list, and we will contact you on to let you know that you need to return to testing. And then we as case managers would like to encourage the nursing staff like LPNs and RNs to use their nursing skills. You know, if somebody has a blood pressure that's low, you call the doctor, you put a progress note in, you put it in your report for the next oncoming shift. Do not leave it for the next oncoming shift to deal with, or the next case manager, for the case manager to return on Monday to deal with, such as medications not coming from pharmacy, vitals. We want you to start using your nursing skills and fax or call for issues and not wait until Monday for things to be resolved. The other thing is, if orders are coming, do not push them on to the oncoming shift. We do need to complete those in a timely manner. We do have a nursing department party on the 18th. So this is the 11th today. So the 18th is next Friday, and it's in Sedan at Heidi's Bar. I do have the room reserved. That would be great if everybody could show up. If you have Valentine's candy that you would want to give to your nursing department coworkers, you can drop it off with Elisa and she'll put it in my office. I'll organize it into bags for everybody. And then if you have not met up with Kim Wickman, for ADL coding for the CNAs, please get in contact with her because there's a bunch of education to be completed for you. If you have any questions, just let me know. Leave me a note in my box, call me. If you have any concerns, please do so also. Thank you for watching and have a nice day. Bye-bye.